Hello, my name is Barbara Vanderpool. I'm the current president of the American STD Association, and I'd like to thank you for taking time out of your schedule to join us for this session where we honor and recognize the awardees for the 2020 American STD Association Recognition Awards. I would encourage you to please go to ASTDA.org, check out our website. If you're not already a member, you can find out how to join. You'll also find out more about the awards that we're giving. And at the end of this meeting, you'll be able to see all of these presentations on the website. So the American STD Association's mission is to foster scientific knowledge, develop leadership, and champion practice in the field of sexually transmitted infections. We have many ways that we go about doing this. Again, I would encourage you to visit our website for more information. But one of our objectives is to recognize outstanding contributions in STI control and prevention. So each year we give out a number of awards designed to help recognize people that have made significant contributions. The first award that I'm going to mention is the award for publication in sexually transmitted diseases, the journal owned by the association, for an outstanding paper written by a young investigator. This year's award winner is Dr. Mirtha de Laat from the Netherlands, and she wrote a paper titled Ceftriaxone Reduced Susceptible Neisseria Gonorrhea in the Netherlands from 2009 to 2017. She will be receiving a certificate and a small prize in recognition of her achievement. Now, we also give out 3 recognition awards every year. The first of these is the Young Investigator Award. This is presented to a person engaged in outstanding work in the field of sexually transmitted diseases who is no more than 7 years from completion of their training. This year's award winner for a young investigator is Dr. Claire Bristow. Dr. Bristow is an assistant professor in the Division of Infectious Diseases and Global Public Health at the University of California, San Diego. Her research focuses on the implementation and evaluation of novel diagnostic strategies, including multi-STI testing and antimicrobial susceptibility determination, in order to increase testing and treatment programs, integration, and effectiveness. Now we're going to hear a brief statement from Dr. Bristow.
Thank you so much for this award. It's such an honor to be recognized. I'm inspired by the work of so many members and past awardees of the ASTDA, so this award is particularly impactful for me. I want to thank some of my mentors who've helped in my training and been models to me that have gotten me to this point. First is Dr. Jeff Klausner, who I had the pleasure to work with at CDC in South Africa over 10 years ago, who then became my primary mentor at UCLA when I was conducting my PhD. Working with Jeff was my first introduction into STD research, and that work really ignited my desire to continue. I'd also like to thank additional mentors, Dr. Stephanie Strathty and Dr. Davy Smith at UC San Diego, and all of my colleagues and collaborators from around the world who make my job fun and who I continue to learn so much from. Thank you again for this award. It's such a tremendous honor.
Our next award is titled the Achievement Award, and this is presented to a person at the mid-career stage to acknowledge an outstanding body of work in sexually transmitted infections. This year's award winner is Dr. Gina Ogilvie. Dr. Ogilvie is a professor and a Canada Research Chair at the University of British Columbia School of Population and Public Health. She's a senior public health scientist at the BC Centre for Disease Control, and she's the Associate Director of Women's Research Institute. Her focus is on the public health and clinical aspects of testing and interventions for reproductive tract infections, HPV screening, and HPV vaccine. Her findings have been highly influential in shaping public health policy for screening, testing, and treatment in Canada and globally. She sits on many national and global advisories, including for the Canada Partnership Against Cervical Cancer, Public Health Agency of Canada, the World Health Organization, and several ministries of health globally, providing guidance on screening, testing, policies for STI, HIV, as well as HPV and STI vaccine policy and programming. And now a few words from Dr. Ogilvie.
Good afternoon. I want to take a moment to thank the American STD Association for selecting me for this year's Achievement Award. I have to tell you, in the middle of COVID, it was such a delight and actually such a surprise to receive this honor. And I was particularly tickled because it was, of course, I was nominated by colleagues who are very dear to me. So I really want to thank them for taking the time to pull together that nomination and thank the association for selecting me. When you get an award like this, I really am simply just the reflection of an incredible team. And here in British Columbia and in Canada, I have the privilege to work with a tremendous amount of very gifted clinicians and scientists and trainees. And I've written a list because I want to make sure I don't forget any of them. So particularly, I want to thank Ruth Elwood Martin, who was one of the first family physicians who worked on our work in HPV and self-collection. And she was really critical in the early years of my career in making sure I was part of this incredible team. And then others who have been leaders in cervical cancer prevention throughout their entire careers. Dirk Vinnie Kirk, Andy Coleman, Mel Crashton, Simon Dobson, Diane Miller, and Manish Satarangani, among many others. I also want to thank Deborah Money for her ongoing mentorship and leadership in this field. I want to also acknowledge Eduardo Franco, who's been a giant in this field in Canada and globally, and has really been a critical part of helping shape my career. And then I finally want to just acknowledge the team who I work with every day, and particularly Laurie Smith, who's been an incredible program manager for our research and our implementation science work. And certainly without Laurie, none of what the team has done could have been achieved. I've been privileged since the start of my career to be able to keep women and keep women's health at the forefront of my work. And it's really important, I think, when you are building your career and when you're thinking about a career, to have a real passion. And so for me, working with women, but also working with in an area where we had lots of tools and there were challenges around optimizing those tools and really designing trials to make sure we understood how to best use them has been a real privilege. And so looking forward and working with groups like the WHO and PAHO and the Canadian Partnership Against Cancer, American Cancer Society, to eliminate cervical cancer is just a real privilege for me to be able to do that. You know, I think it's been really clear through COVID that how important health research is. We know that everyone is waiting on tenterhooks for well-designed trials to help us understand how to prevent, how to treat, and how to help people recover best from COVID. And so I think one of the opportunities we have with COVID is to show how important and how valuable and how critical health research is. So I want to thank the ASTDA for thinking about me for this award, for giving it to me this year, and for acknowledging the important work that health researchers do, particularly in the field of eliminating cervical cancer. So thank you very much, and I look forward to meeting in person in the future.
And finally, the most coveted award that the ASTDA provides every year is the Distinguished Career Award. And this is presented to a person with a long and extraordinary career in the field of sexually transmitted infections. And this year's award winner, very appropriately, is Dr. Gail Ballen. Gail received her undergraduate training at Goucher College in Maryland, her medical education at Dartmouth, and her residency training at the University of Virginia. Prior to attending medical school, Gail worked as a chemist at National Institutes of Health National Cancer Institute. Gail also had fellowship training at the CDC's Epidemiologic Intelligence Service, Tufts, and Stanford. And for the last 33 years, Gail has worked at local, state, and national public health agencies with a focus on STI control. In January of 2021, Gail will be stepping down from the position of Director for the Division of STD Prevention at the CDC, which she has held since 2011. She has made large and sustained contributions to the field of STI, HIV, and sexual health during her nearly 40-year career. Having worked at the local, state, and federal levels, Dr. Bolan has leveraged her unique perspectives to modernize STI and HIV prevention, both locally and nationally. And she has led with commitment and passion to help move our field forward. First, we're going to hear a brief tribute from Dr. Bolan's colleagues, and then we're going to hear from Dr. Bolan herself. So thank you so much for your service, Gail. I'm terribly pleased that this can go to you because I think that, especially in this era of understanding epidemiology as well as diagnostics, as well as medical care, you bring everything to the field that we need right this minute. Thank you so much for all of your contribution and your commitment to our field. Hi, Gail, and welcome to my home. For those of you who don't know me, I'm Barbara Vanderpool, and I'm the current president of the American STD Association. And it's our real honor to be able to award Gail Ballen with this year's Distinguished Career Award. I can't think of anybody who's more deserving than Gail, and especially during these times where we realize that public health is so critical, and Gail has committed her entire life and career to that effort. So we want to thank you and we want to celebrate you. And although we can't have the party that we would all like to be having, I suggest that anyone who's watching this who can, raise a toast to Gail and say congratulations. Thanks, Gail, for all you've done for our field.
Hello, I'm Art Reingold. Some in the STD field know me as Mr. Gail Ballen. And I'd like to say just a few words about my wife of 35 years as we celebrate her many accomplishments. You know, it hasn't been easy being married to the STD Queen these last 35 years. You can see that my life is filled with t-shirts and other paraphernalia that primarily are interested in the prevention and control of sexually transmitted diseases. And I can tell you that more than a few students and other people coming to see me in my office have been somewhat put off by the row of healthy penises arrayed on a shelf above my desk in all different ethnicities and races. So you can imagine what that's been like for my 3 children, but perhaps they've told some stories already about what it was like to grow up with the STD Queen as their mother, and virtually daily discussion of body parts and various diseases that affect them. I want to talk about a slightly different issue in the little bit of time I have today, which is to relate the story of how Gail came to work at CDC almost 10 years ago. It was, in fact, pretty much exactly 10 years ago when Gail came home from work and told me that she heard that the position as the director of the Division of STDs at CDC was open. She was being encouraged to apply, and she was thinking about it. I knew immediately at that point, A, that she would apply, B, that she would be offered the job, and C, that she would take it, even though I expressed my general unwillingness to move back to Atlanta. And of course, that prediction was correct. She was offered the job. She did take it effective February 1st. It will be exactly 10 years next February 1st, promising me that she would be able to fix everything wrong with CDC and the federal government in 5 years and be home. Well, it's almost 10 years later, and I think many of the people in the audience might suggest Gail still hasn't quite accomplished that lofty goal. In any event, because Gail doesn't cook or shop, and because I've maintained that she lives in California, even as she works in Atlanta, I have acquired the world's largest collection of Tupperware, and as a result, every week send her home to Atlanta, or rather back to Atlanta, with a suitcase filled with Tupperware that contains what, when it's put into the Tupperware, is nutritious, healthy, good tasting, and good smelling food. Now, I gather from some rumors I've heard that perhaps when those containers sit in, on, or under her desk for several weeks, that perhaps they don't smell quite as good as they did when they left California, but that's really not my fault. So in any event, I want to congratulate Gail, who I love very much, for her extraordinary accomplishments and achievements in the fields of STD. And if anyone would like to buy some slightly used Tupperware, we have quite a bit that's available. Thanks very much. Bye.
I first met Gail Ballen when I was interviewing for ID fellowship at University of California, San Francisco, a long time ago, so long ago that she was pregnant with her youngest child, Jake. And just yesterday, I received a photo of her with her first grandchild on her lap. And to me, that encapsulates the fact that Gail has been there for me through my entire career. She's been unwaveringly supportive, unwaveringly promoting me as a strong academic leader and as a woman in infectious diseases and the STD world. And she's also, despite her very practical nature, got a really caring streak that makes putting her in the context of a mom and a grandmom really delightful for me. So I can't thank her enough. I love you, Gail.
Hi, Gail. This is Joan, talking to you from California, your home state. Congratulations on having such an incredible career, both in California and at CDC, and you were so instrumental in giving me a chance to really enter the real world of STD prevention in California 20 years ago. So thank you for that. I'd give my shirt off my back anytime for you. In fact, I actually did at one point. Remember that time the television crew showed up with 20 minutes notice, and they wanted to do an interview with you right in the office. So not having enough time to go home and change out of your t-shirt and sweatpants, you ran around the office looking for anyone who had spare clothes, and you came around to my office, the only one, and I had a turtleneck and a v-neck sweater and pearls. And you said, can you borrow them? And we did. We swapped my clothes for your t-shirt, and you declined to actually take the pearls because you felt that if you showed up on camera with pearls, no one would believe that it would be you. So that was my fun experience working with you on a clothes swap. So have fun in retirement. Don't worry, you can wear whatever you want, and not even pearls. Love you, bye.
Hi Gail, congratulations on this richly deserved award. I have an enduring recollection that reflects your dedication to STD prevention, starting well before you became director of the SD division at CDC. As a frequent consultant to the division, you typically arrived the morning a meeting started, having taken a red-eye flight, skipping dinner the night before, not to mention a good night's rest. In you strode in your traveling clothes, wearing shoes that suggested that you might have run rather than flown to Atlanta. Nevertheless, you seemed refreshed, you were effective, ready to work. I'm told this pattern continued not infrequently after you became division director, having kept your home in San Francisco. All this, of course, reflects a balance between your career on the one hand and art and the kids on the other. And it's not untypical for women, of course, as you work to break that glass ceiling. To paraphrase Ann Richards, your professional accomplishments have been achieved backwards in tennis shoes, perhaps, rather than high heels. Your dedication to both priorities has been inspirational, and I suppose that all that flight time was when you got a lot of the work done behind the award. Anyway, congratulations again, and thank you so much for your work on the issues we all care so much about.
Hi, my name is Becca. I'm Gail's daughter, and this is Jacob, her new grandson. So when I was in 6th grade, I switched to a new school, and the school was thrilled to learn that my mom worked in STDs because they were in need of a new sex ed teacher. Fortunately, I was able to talk my mom out of serving as the new sex ed teacher, seeing as I obviously didn't want to have that reputation for the remainder of my middle school experience. But my mom did convince me to wear a t-shirt to my first day of sex ed class. Now that t-shirt had a picture of Michelangelo's David and said, "Get cultured." So my sex ed teacher certainly got a kick out of it, but I'm not sure that any of the students in the class really appreciated the humor. So unfortunately, I wasn't able to completely disassociate myself from STDs for the remainder of my middle school experience. Mom, congratulations. We love you very much.
Congratulations, Gail. Well deserved. I have learned so much from you about programs and partnerships, and I cherish our friendship. I will miss our Wednesday evening dinners at Nino's. I will even miss that first glass of wine, which I often had to have by myself because you were delayed in traffic. Please come back every now and then just to have dinner with me. And do enjoy grandmotherhood. It is one of the most wonderful things in life.
Congratulations on the award, Mom. I know it's well deserved. Knowing what you had to go through to raise me, I'm sure you deserve the Mother of the Century Award as well. So over the decades, there's been so many great stories I could recount, from burnt breakfasts to horrifying STD dinner table conversations. But there's one I remember regarding swim practice. So as the amazing mother you are, you'd always drop me off and pick me up from swim practice every day. And I remember one time you were taking a nap in your car, your old Toyota Camry, while waiting for me. And as I was walking up to the car, you seemed very frustrated and angry as you couldn't open your door. You tried and tried, but the door was just sealed shut. You were begging me to help you open the door as you became more impatient. I immediately noticed there was duct tape covering the entire door, and I couldn't help but just burst out in laughter. And you just became more and more annoyed and yelled at me that it wasn't funny and you didn't know what was wrong. So I took the duct tape off the door and I let you out of the car, and you saw what happened. Some high school kids pulled off a great prank on you, and in the end you couldn't help but laugh as well. So Mom, it's just one of many stories I could tell, but I don't know where I'd be without you today. You've always been there for me, especially when I need you most, and you're always going to be my hero. Love you, Mom.
Growing up with Gail Ballen as your mother meant that you got to experience her multitasking skills firsthand. For example, a typical drive from school to swim practice involved my mom talking on the phone about barriers to expedited partner therapy while drinking a 9-hour-old cup of coffee and combing her hair. Keep in mind, this is also while she was driving stick shift. At some point, she would run out of hands and then delegate me as her personal assistant to take notes for her for these meetings and her voicemails. But in between phone calls, she would always find the time to ask me about my day. I've always been impressed with my mother's ability to juggle work and family. I know she's made a huge difference in the STI world, and yet she's always found time for her family. Mom, I'm so proud of you, and I love you.
Hello, Gail. For the past 25 years that I've known and worked with you, I've been inspired by your unwavering passion for STI control and prevention. You certainly have had a very distinguished career, and therefore, congratulations on a well-deserved award. I greet you from the land of retirement, where we will soon welcome you. It's a very nice land indeed. The sky is always blue, the sun never sets, and all the people are nice. Cheers and welcome.
Okay, congratulations on this very well-deserved recognition. Before I share a few things I learned during our work together, I want to thank you for your vision and for driving the strategic direction of our field. Gail values communication and partnerships, and as many of us can attest, she's always just a phone call away. And these days, surprising us all, she's just a text message away. After relying on her trusty flip phone for many years, she has finally joined us in the world of smartphones and emojis. Gail is in many ways the anti-bureaucrat, repeatedly declining to do something the CDC way because it makes things harder for our state and local partners. And Gail works hard. If you have ever been on the phone with her at the airport, you know she's working up until the moment the flight attendant physically forces her to shut down her phone. Gail, thank you. Thank you for your commitment to our field, for your leadership, and for your friendship. Again, congratulations.
Hi, it is my great honor to have known Gail and to be her colleague, coworker in public health, and most importantly, her friend. I've had the pleasure of traveling the world with Gail to World Health Organization, to numerous meetings, and of working with her on important public health goals, too many to mention here, but those are the real tribute to Gail Ballen. During all this time, she has been a great mentor on public health and has taught this microbiologist so many things: contact tracing, screening, what clinics our most underserved communities need, and where we could really help. Now, I do admit there have been some challenges. A conversation with Gail is like living in a James Joyce novel. The sentences and ideas keep coming and coming and coming. Those of you who've experienced that know exactly what I mean. Kidding aside, Gail, I can't tell you how much your friendship has meant to me over the years. I can only wish you and Art the very, very best and enjoy those grandkids. Thanks so much.
This is Jonathan Zellman. Gail, congratulations on a job well done. When you first started getting into STDs back in the 1990s, I think that was in San Francisco, we were at a meeting and you came up to me and said, Jonathan, what's all this STD stuff all about? It's so complicated. There's behavior, there's partners. What do you do with partners? You were into pneumococcus back then. You kept on saying pneumococcus is much easier. No partners, no nothing. Well, anyway, I think you figured it out. And I really want to congratulate you on your leadership and all the stuff that you've done for the STD world over the past years.
Hi, Gail. As I sit here in the same clothes I've been wearing since March, I'm pretty darn sure. I do want to send you a huge congratulations on the Career Achievement Award. You're joining a small club of important overachievers, and you certainly are one. Then I heard your return. What? I have a strong feeling that your sneakers will keep you on the move. STIs are definitely in your blood. Okay, that might not be quite right, but I think you get it. You may trade those sneakers for flip-flops, but I'm guessing that won't last long as we'll all be calling you. Congratulations again, Gail. I can't think of anyone more deserving. And enjoy those grandbabies.
My congratulations to the others found on this video, period. You're a deserving and worthy recipient of the Thomas Perrin Award. As you know, our paths have crossed and even intertwined for decades, and I'm all the better for my many interactions with you and our many conversations. You've added so much to our profession and made lasting contributions to America's sexual health. Thanks so much for all that you've done. On a personal level, it's been my great pleasure to work with you and from time to time for you. Please accept my heartfelt congratulations. I look forward to seeing you soon.
There's a sad sort of rumor at the CDC. No one really believes it's true. It's worse than a budget cut, it's worse than a freeze. It's driving us to cry, boo-hoo, boo-hoo, boo-hoo. When rates are climbing higher, oh how can you retire and make us say goodbye, boo-hoo, to you. I remember our first CDC grant deadline. We turned it in at 11:59. Do.
You saved me from the looming ivory tower, cut through red tape with Bolan superpower. Do.
You made me laugh no matter what the workload and how we enjoyed the same informal wardrobe. Do.
You taught me well so that I wouldn't miss a scrotal rash or neurosyphilis. So long, farewell, auf Wiedersehen, adieu. There'll never be a director such as you.
Your move makes others feel they have to mourn ya. We're glad you're coming back to California. So long, farewell, auf Wiedersehen, goodbye, 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 goodbye. Come home soon.
Congratulations, Mom.
Thank you very much, Sarah. Good morning or afternoon, depending on your time zone. First, let me begin by thanking ASTDA. I am both honored and humbled by this 2020 Distinguished Career Award. My career has been spent trying to bridge science and policy and program, making programs more evidence-based, and science and policy more programmatically relevant. As you will hear today, there is still much to be done. I must also give a special thanks to Kyle Bernstein and Laura Bachman, who secretly submitted the ASTDA nomination paperwork. I was completely unaware of their submission and had to do some good old-fashioned DIS investigating to find out who was responsible for my nomination. Next, I'm thankful for Bobby's kind and delightful introduction. Bobby's been a great colleague, and I'm pleased to receive the award from her during her tenure as president of ASTDA. Finally, I'm so grateful for Lynn Barker, the CEO of ASHA. She was the force of nature behind this event. She and Bobby came up with the tribute idea, and Lynn has worked tirelessly putting this together. I even hear she's become best friends with my husband, who needs all the tech help he can get, and has retaped his segment 3 times because of wardrobe malfunctions. To everyone who shared a tribute message, I would like to thank each of you for your collective appreciation, humor, and stories. Today, I've been asked to reflect on my work and how I came to do what I'm doing. As for the latter, the answer is simple: serendipity. As for the former, I prefer to reflect on our work as a journey. We all know it takes a village to prevent STDs, and that STD work is a team sport. My career path began with academic medicine and bench research, but in 1982, I took a fellowship with CDC's Epidemic Intelligence Service that changed everything. The supportive and collaborative public health culture, the goals of using data for public health action and impacting population health, and a Group C strep outbreak in New Mexico, where Dr. Jonathan Mann, then the state epidemiologist, who told me, quote, "I have no idea why you would consider working at CDC after EIS. Don't you know all the action is at the local level? Feds can't even work in a state without an invitation." It altered my career trajectory. It also didn't hurt that I met my life partner, Art, at CDC, who calls himself Mr. Bolan and likes to think he saved me from myself. In 1987, after completing my EIS fellowship in infectious disease training, Art and I were living in San Francisco and Oakland. At the same time, the San Francisco Department of Public Health STD director position was the only public health position opened in the Bay Area. I was completely unqualified for the position by most standards, never had seen a case of syphilis, never had cared for a transgender person, had no STD publications, and the only sexual health question I was taught in medical school was, have you ever had any problems with impotence? But the person hiring must have been a bit nuts and selected me for the position anyway. So my journey in the field of STDs began. As director, I quickly learned the incredible value of public health and academic partnerships that are mutually beneficial if true collaborations are established. And I encourage all of you to explore these types of partnerships in your jurisdictions if available. In the early 1990s, we transformed City Clinic into a center of STD HIV excellence, which continues to deliver high quality comprehensive clinical care while also providing sexual health training to medical and nursing students and residents and conducting programmatically relevant STD research. We integrated hepatitis B vaccination, pap smears, intimate partner violence and substance use screening services, started the Thursday morning clinic, an appointment-based clinic for HIV care and family planning services, and dabbled in billing for services. Julie Schechter may deny he said this, but he encouraged me when I arrived in San Francisco to pursue bacterial vaginosis research because, quote, no one at UCSF was working in that area. My response, I told him my job was to prevent STDs and that I would focus on diseases where the natural history and effective prevention interventions were known, and I was happy to work with him on chlamydia. I am grateful for years of academic collaborations with many of you, and I'm not sure what I would be doing now if I had followed his BV advice. My journey continued moving from the local to the state public health in 1997 when I joined the California Department of Public Health STD branch. After more than a decade with the state, I returned to CDC in 2011 as the director of the Division of STD Prevention. When I interviewed with Dr. Kevin Fenton, he asked me, why have you only had 2 jobs in your career? It never struck me that having only 2 jobs wasn't the norm for a future director, but I realized in my response to him that I had chosen my journey on my terms and not what others thought I should do. My answer was that I was a builder more than a climber and wanted to make sure I was home for my family before all were grown. Well, clearly he hired me anyway, and that is how I came to CDC. Successes for me were not tied solely to work, but also measured by a work-life balance thanks to art. A few of you may remember when I brought Sarah to the first PI meeting of Bob Rawls' syphilis study, the first randomized controlled trial of syphilis in the post-antibiotic era, as my husband was on a trip. Sarah was 3 months old and didn't take a bottle, which resulted in a few shocked PIs as I breastfed during the meeting. At the annual PI meetings after that, I would always mark the passage of time by how old Sarah was. Sarah was in 5th grade when this landmark syphilis study was finally published in the New England Journal in 1997. Though I must admit, I'm now a bit more forgiving about CDC timelines since coming to CDC to work. As I reflect on my time in STDs over these past 30 years, I'm struck both by the progress made and the challenges that are still left in the field. As many of you know all too well, STDs have surged for the 5th consecutive year in 2018, reaching an all-time high, and it looks like this trend is continuing in 2019. Nationally, over 2.5 million cases of chlamydia, gonorrhea, and syphilis were reported to CDC in 2018. STDs can impact anyone, yet the disparities deepen for the most vulnerable groups. Youth, ages 15 to 24, have long accounted for most reportable chlamydia and gonorrhea infections, and now are experiencing syphilis increases too. The disparities among gay, bisexual, and other men who have sex with men is stark. MSM make up the majority of syphilis cases. In 2018, 1 out of every 282 MSM was diagnosed with primary or secondary syphilis. This was 122 times the rate among men who have sex with women. Pregnant women face some of the harshest outcomes from untreated STDs, as underscored by the continued rise in congenital syphilis. In fact, a recent CDC analysis found that in 2018, 1 in 2 newborn syphilis cases in the United States occurred due to gaps in testing and treatment during prenatal care. Commonly missed opportunities to prevent congenital syphilis also differed by region, illustrating the importance of tailoring prevention solutions to this most tragic consequence of the growing syphilis epidemic. If rising syphilis cases were not enough, the threat of untreatable gonorrhea is alive and well. Gonorrhea has dramatically increased since 2013, the first time since the 70s, and it can't be explained solely by increases in screening. However, while gonorrhea cases are increasing, no cases of antibiotic-resistant gonorrhea have been found in the United States. With the downturn of the economy in the late 2000s, erosion of state and local public health infrastructure began to occur. STD specialty clinics, settings known for serving MSM and other populations seeking confidential STD care services, closed, and a number of public health staff decreased, resulting in reduced availability of same-day treatment for individuals with STDs, particularly infectious syphilis. Furthermore, fewer patients and partners were linked to care and treatment. The crippled infrastructure has not yet recovered and is still a factor contributing to less timely detection and treatment of cases leading to further transmission in the community. After the AIDS epidemic in late 1980s and early 1990s, syphilis began to rise among gay, bisexual, and other MSM in the early 2000s, when the availability of life-saving medications had an impact on sexual activity and sexual norms. Several years later, in 2012, the development of PrEP, which requires routine STD screening, altered the game of STD prevention and control, again by providing additional opportunities to detect and treat STDs. While opportunities for screening with PrEP have increased, the ability to locate partners has become more challenging. The use of the internet and geosocial networking apps for meeting sexual partners has exploded in recent years. These apps eliminate geographic limitations and make it easier for individuals to connect with and meet new people. In 2016, almost 50% of individuals with early syphilis in San Francisco reported using geosocial networking apps to meet partners. This is a dramatic departure from the bars and bathhouses where partners met previously. It's interesting that the approaches to syphilis prevention and control in particular have not changed much in almost 100 years. In Surgeon General Dr. Thomas Perrin's Shadow on the Land, published in 1937, he outlined a syphilis control approach that is akin to the most recent syphilis elimination efforts. First, he highlighted the need for a government role in the prevention and control of a private social disease, while others argued at the time that sexual activity is a voluntary activity where individuals should take responsibility for his or her actions. HIV is a clear example as to how the role of government intervention improves the social well-being of a society. Second, Dr. Perrin provided a platform for action, recognizing that there were still many unsolved scientific answers about syphilis, but felt the diagnostic and treatment tools of the time were good enough. Often in public health, we have to proceed with good enough and not wait for the perfect scientific answer. These principles are still applicable today for the STD field, though advancements are underway. Within the next 6 months, the first ever federal STI strategic plan and a state of the state of STI National Academies of Science, Engineering, and Medicine report are planned for release. These plans and strategies are essential, but not completely sufficient. The what is important, but the how and the implementation are more so. As I said, to reverse these trends, it cannot be done by one sector. It's going to take a village, including partnerships between federal government, health departments, academia, healthcare providers and systems, community-based organizations and communities, industry, policymakers, and more. More science and innovation is needed to inform program interventions of high impact in areas of population composition and social determinants of health, network dynamics and behaviors, and technologies, so the healthiest choice is the easiest choice. COVID-19 has exposed what many in the field of STD have known surrounding the limits and weaknesses of our society's infrastructure and safety nets that include, at the basic level, community trust and trained staff. Consequently, alternate models to increase access to timely testing and treatment, such as express visits, testing outside the healthcare setting in pharmacies and homes, and growing telemedicine models are needed more than ever. Our innovations need to be holistic. We must examine not only the disease itself, but how the disease occurs in the context of patients' lives, ensuring linkages for co-occurring conditions, and offering integrated comprehensive care at the client level. We live in a world with rapidly changing technologies, and we need to keep pace with the world around us and take advantage of opportunities. By investing in a comprehensive health equity approach and recognizing the power of communities, the need for culturally sensitive healthcare facilities, and the importance of trust in community leaders, STD trends can be reversed. Few fields of medicine are more dynamic and diverse than that of the field of STDs. The focus has moved from the individual patient to their lives and their communities, from individual bugs to the communities of organisms in the microbiome, and from siloed, limited data systems to large volume data clouds with unlimited variety and velocity in data science. That is why STDs is an extraordinary and professionally rewarding field if you like diversity and challenges. We may be under-resourced, but we make up for that in ingenuity, resilience, innovation, perseverance, and the ability to adapt quickly when change is needed. But we cannot do this without a new generation of STD leaders and champions in the field. I'd like to leave you with this. STDs are a societal problem, a collective responsibility, and a measure of our nation's health. And I would not be where I am today without many colleagues, mentors, staff, patients, and family who have taught me everything I know. Too many to list, but have to thank the staff in San Francisco, the California Department of Public Health and CDC, patients at City Clinic, colleagues in the STD family and beyond, and lastly, my growing nuclear family, Art, Becca, Sarah, Brett, Jake, Eric, Jacob, and Danny, who make me laugh every day. Thank you.
Hi, I'd like to thank you for taking the time to spend with us today in recognition of this year's awardees for their contribution to the field of sexually transmitted diseases research, program, and control. If you'd like to find out more about the American STD Association, please go to our website at astda.org, where you can find out more about the awards that we give out, as well as the activities in which we're currently engaged. Thank you again.